It is time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon Lapook and CBS News contributor Dr. Holly Phillips. First up this week, the White House budget director announced more than $500 million is being rushed into the battle against the Zika virus. Mosquitoes have spread the virus through most of the Western Hemisphere, and the U.S. could be next. John has more on how that money could be spent.
That's perfect for breeding mosquito larvae.
Tropical disease expert Dr. Peter Hotez has been warning for months that poor neighborhoods on the Gulf Coast, like this one in Houston, are similar to poor neighborhoods in Brazil, the epicenter of the Zika pandemic. Broken screens, lack of air conditioning, and standing water make for perfect breeding grounds for the Aedes aegypti mosquitoes that carry Zika.
If you look to see where Zika is devastating families, mothers and their unborn babies or their newborn babies throughout the Americas, it's in the areas of extreme poverty.
Hotez is worried the U.S. is not prepared to fight the Zika virus, despite the commitment of over $500 million. Congress still hasn't approved a $1.9 billion request. And with warm weather fast approaching, Dr. Anthony Fauci of the NIH says he's not waiting any longer.
I'm taking money from other areas that we fund in order to fund the very important Zika research, particularly the Zika vaccine research.
The Aedes aegypti mosquito is most often found in the south, but a new CDC map indicates its potential to reach as far north as New York and Ohio. The biggest concern is for pregnant women. In Brazil, Zika virus has been linked with microcephaly, babies born with an abnormally small head and brain. The administration says the new funding will go towards vaccine development as well as mosquito surveillance and control.
There's no such thing as a small outbreak of Zika. If you start seeing babies with microcephaly on the Gulf Coast of the United States, it is going to be a public health crisis. It would be the public health equivalent of Katrina.
So what is the next step in the U.S.?
Well, to be sure, the administration still wants the $1.9 billion that it's requested in aid. It requested it from Congress in February, and still it hasn't been approved. And let's put this in perspective. There's broad consensus from every expert I've spoken to that it's either inevitable or almost inevitable that the Zika virus is going to come to a mosquito inside the United States. Now, do we really want to look back and say, what were we thinking? We had the warning. We had the time. Why didn't we prepare? And that means funding vaccine development, all sorts of ability to go on the local and state level and do surveillance. Is the Zika virus in mosquitoes? Is it in people? You need to develop testing. And very importantly, you need to be able to go into these especially poor areas, these neighborhoods that are not that dissimilar from Dr. Hotez was pointing out from Brazil, that have standing water and all sorts of lack of air conditioning screens, and start cleaning things up. When I was in Recife, which is the epicenter in Brazil, I was with the soldiers. They were going from house to house. And we certainly should be doing a similar effort here in the United States to get ahead of this whole outbreak.
We have to act now. All right. Next up, the World Health Organization has released some startling new statistics on the number of diabetes cases in this country and abroad. It found the number of adults living with diabetes has quadrupled since 1980. In the U.S. alone, the number of cases among men has jumped by 80% over that time, and cases among women have increased by 50%. Holly, what's fueling this?
You know, it's directly related to the increase in obesity, almost number by number. You know, we focus a lot and talk a lot about the obesity epidemic in the United States, where 2/3 of adults are either overweight or obese. And sometimes we can lose sight of the fact that this is actually a worldwide issue. Worldwide, 1 in 3 adults is overweight, approximately 1 in 10 is obese. And the diabetes rates are going up directly related to that.
But why now? Why is the World Health Organization saying let's really pay attention to it now?
Sure. Unless we see a dramatic decrease or a sort of a quick reversal of these numbers, diabetes is really poised to be one of the top global public health concerns in the next very few years. When we look at medical complications, right? You see vision loss, kidney failure, neuropathy, which is nerve problems in the legs. You see amputations, and the cost is overwhelming. What's the number? $827 billion already spent every year. A lot of that is disproportionately it falls on low and middle income countries that really can't absorb those health costs. So the World Health Organization is focusing on it now, and even they admit arguably maybe it's a little bit late in the game.
What do we do to curb this, John?
We know without a doubt, definitively, that better nutrition, weight loss, doing exercise does wonders here. So the question is, how do you do that? And I was hoping we could actually, you know, Holly, in your practice, people come in, it's the same problem. I'm not exercising, I'm overweight. What do you tell them? What's the real life advice?
You know, what I do is I say take it one day at a time, because losing weight, I think, is one of the most challenging things any person can do, whether you're trying to lose 2 pounds, 20 pounds, or 200. So I look at it and I say, if you're completely sedentary, today, walk around the block. Yeah. If you have 3 sodas a day, today have 2, and then see what happens tomorrow. Try and make tiny changes that are actually realistic, and then you're more able to stick with those. You know, one of the things about diabetes is that it's largely preventable, but it's also wonderfully reversible, right? Whether or not you can get rid of it altogether, you can manage it very well, both through weight loss and medication. So I try and say little steps. What about you?
Well, nutrition, I think, you know, getting rid of mindless eating. This Brian Wansink wrote this great book. I don't get any kickback on the book, Brian. It's called Mindless Eating. It's fantastic. It talks about how we eat when we're not paying attention to it. So the worst thing you can do is be in front of a television set and just eating like that. Get smaller plates. I tell my patients, the kitchen's closed after 9 o'clock. It's closed. You know, when you go in there because you're bored. So there are all these things that you can do to try to encourage people, and also then being realistic. Because I think, I just spoke to somebody today who said, I only lost 5 pounds in a month. That's amazing.
That's huge.
Think about it. It's 3,500 calories in a pound of fat. So if you normally have 2,000 calories as a diet, and you go down to 1,500, that's amazing to lose 500. And that's 500 calories a day in 1 week. That's 1 pound in a week, which is great.
John will be proud of you.
Yeah.
That's all you need.
One step at a time. One step at a time. Dr. Jon Lapook and Holly Phillips, thank you both very much.